Healthcare companies look at the Affordable Care Act and they think, oh, terrific. This is an opportunity for us to scam our own customers. Now, why and how? Well, it turns out there's a lot of confusion, right? And especially if you watch Fox News, they're like, oh my God, it's your plan got worse. You can't keep your old plan. Obama lied to you. Right? Okay, so what are they doing? Well, some of them, like Lifewise of Washington, are sending out letters saying, nope, that's it. You can't keep your old plan. You got to sign up for a much more expensive one. But wait, turns out that they're not telling you about the exchanges. In fact, they're keeping that from you in order to get you to sign up to a more expensive plan when in fact the exchanges have less expensive plans. So there's this woman named Donna. She lives in Seattle. Talking Points member talked to her. And Dylan Scott has a good article about this. And her insurance company, like I said, was Lifewise. She's 56 years old. She's got a 57-year-old husband, a 15-year-old daughter. They make about $40,000 a year, okay? So they got to be, of course, really careful with what they buy. Well, it turns out that they said it's going to cost her $300 a month extra for this coverage because of, all these transitions and changes, et cetera. Well, it turns out that when they looked into it, if Donna had done nothing at all, she would have ended up spending $1,000 more a month because of the changes that her insurance company was forcing upon her. Then if she went into the exchanges. Well, TPM did the reporting on it, and it turns out, no, she would save a lot from Obamacare. In fact, she goes on to say when she's presented with the real evidence of what can be done, she says, the info that we were sent by Lifewise was totally bogus. Why the heck did they try to screw us? Well, Donna, there I have an excellent answer for you. It's because they're a corporation. That's their job. Now, the job of a corporation is not to screw you, but it is to literally get as much money from you as possible. So, as you're going to find out from quotes from their spokespeople in a second, they're like, Donna, our job isn't to give a damn about you. It's to maximize profits. And anybody will admit that, any conservative, et cetera. Yeah, maximize profits. And in this case, they're like, this is a great opportunity to kind of trick people into paying us more when in fact they should be paying us less. So it's not just Lifewise, there's Humana, and Humana, by the way, is putting like, oh, by the way, you can look at the exchanges, but you know where they put it? In a small footnote much later. First, they're like, you have to change plans, you have to pay us more money. And then if you read all the way at the bottom, oh, by the way, you don't necessarily have to do that. You should look at the exchanges. But they say, like Lifewise, hey, that's your problem, not my problem. I'm not going to tell you the truth. Donna also says, people who are afraid of the Affordable Care Act should be much more afraid of the insurance companies who will exploit the fear and end up overcharging them. To which I say, of course! There's all this fear-mongering about the government, and some of it is justified. Government has gotten gigantic, the NSA spying, the war after war, etc. So there's valid points there. But then on issues where they're actually trying to look out for the average American, whether it's Medicare, Social Security, Medicaid, or this, where they're actually trying to get you better health insurance, so that you don't get excluded with pre-existing conditions, etc., who do you think is going to look out more for you? Them or a company whose job is to maximize profits from you? Look, sometimes those companies make good sneakers or good burgers and everybody wins, right? And sometimes they make insurance plans that wind up saving your life. But also, part of doing that is to get as much money out of you as possible. Saying you trust a company like that makes no sense. It doesn't mean that they're evil. It's just you have to be careful because they're not in it for your health, literally. They're in it for the profits. So, now, let me give you more details about that. So, like I said, TPM has confirmed 2 specific examples of customers that were told prior to the marketplace opening, hey, you've got to switch to a more expensive insurance, when it turns out, of course, if you just wait till after the marketplace is open under the Affordable Care Act, you'll be much better off. So, let's go back to Donna for a second. Now, in Donna's case, TPM reported that, yes, in fact, in the Affordable Care Act marketplace, she would save $1,000 than what her insurance company had tried to switch her into, plus her coverage would actually be better. So for Christ's sake, don't listen to the insurance companies that are sending you bogus letters. Some of them are. Don't listen to Fox News or us or anyone else. This is an important thing. It costs a lot of money. Please look into it yourself. I know it's a pain in the ass. I don't like dealing with insurance. I don't like dealing with all the paperwork. I don't like looking through the footnotes. But this matters a lot to your family. You got to have good coverage and make sure you pay as little as possible. So look into the insurance, what the insurance company tells you. Look into the marketplace, then make an informed decision. So now you can tell how full of it the company is, because Eric Earling is the director of corporate communications at Premier Blue Cross Blue Shield, and the company that I've been telling you about, Lifewise, is an affiliate of them, a subsidiary of them. Here's what he says about the misleading letters. Our experience is that our customers are already aware that they have other options in the market, and that we've never had to tell them in the past that we have competitors. Oh, how is that for an awesome admission of, well, obviously we're trying to screw you. It's our job to try to screw you. It's your job to figure out that there are other people or places you can go, and that in fact, the Obamacare isn't screwing you, it's trying to help you. I don't have to tell you that. Well, he continues, we knew that the marketplace would have a robust marketing campaign for themselves and knew they didn't need additional help from us. Basically saying that Obamacare marketplace, it's so good. I mean, certainly doesn't help us, and it doesn't need help from us. So good luck to you, man. If you figure out that Obamacare rocks, good for you. If you don't, you're going to pay me more money. Well, that's inadvertent honesty, and I like it because it tells you exactly what they're thinking. On the Humana case, they had like I said, the open enrollment period of the marketplaces in a footnote. They've been fined in Kentucky for $65,000 for misleading information. The 2,200 respondents that had signed up for the more expensive plans have been told, hey, you know what? You don't need to do this. This is the reality, and you can actually pay less and get more coverage. So they were able to rewind that. By the way, if you didn't have any regulation, you know how the Republicans always say, goddamn regulation. Well, in Kentucky, those 2,200 people would have been screwed, and they would have been paying thousands of dollars more over the course of a year for God knows how many years, because they were misled and told the wrong information. Regulator helped to figure that out and give them back what they needed and give them real information. That's what a regulator can do. It's not just in Kentucky, it's in 4 different states that Humana has been looked into. In Colorado, they couldn't do a fine, but they were forced to send out an apology letter to their customers saying, yeah, we misled you on that. Oops, we're trying to trick you into paying us more. And I love this from their spokesperson. He says, in retrospect, the letter could have been more consumer friendly, and we've rewritten it with that in mind. In other words, wasn't very consumer friendly because we're looking to screw the consumers, you know how. And Obamacare didn't let us do it. These local state regulators didn't let us do it. Oops. So get the real information.